Today, we will go over the Lisfranc injury, including what it is, typical mechanisms of injury, and some other helpful facts to know about this fracture dislocation cum rotations. Lisfranc injuries cover a spectrum of injuries to the tarsal-metatarsal region of the foot. They can include injury to the Lisfranc ligament, tarsal-metatarsal ligaments, intermetatarsal or intertarsal ligaments, with fractures affecting the proximal metatarsals, cuboid, and/or cuneiform bones. You might also see associated injuries elsewhere in the foot and or ankle, but for this video, we will just focus on the Lisfranc injury. On AP x-rays, there will typically be widening of the space between the first and second metatarsals, as well as between their association with the medial and middle cuneiform, respectively. On 45-degree internal oblique views, one might appreciate lateral displacement of the third metatarsal and the lateral cuneiform, as well as the lateral displacement of the fourth metatarsal on the cuboid. On lateral view, you will typically see dorsal displacement of the metatarsals. Common mechanisms of injury include MVCs, falls from a height, and athletic injuries. Indirect rotational forces, abduction, and axial loading applied to a hyperplantar flexed foot can increase the chances for the dorsolateral displacement of the metatarsal seen in Lisfranc injuries. Symptoms of Lisfranc injuries can vary depending on the severity of the injury, but they often include pain and swelling in the midfoot, difficulty bearing weight on the affected foot, and sometimes bruising or blisters. Treatment can include both operative and non-operative management. Non-operative indications can include if the patient is non-ambulatory at baseline, if they have underlying vascular disease that will impede proper healing, or if the patient is stable with ambulation. Non-operative care will include cast immobilization for 8 weeks. Operative management, on the other hand, can include percutaneous pinning, ORIF, or arthrodesis. Alrighty, that is all for this short overview on what I believe would be helpful to know about Lisfranc injuries at the medical student level. Good luck on rotations, and I will see you all in the next one.